Pituitrin, pituitary gland. This is one of your tautopathic medicines. It was there in that list. I think it was there. Pituitrin or pituitary gland, very, very important medicine. We don't use it so often, but there are really good areas where you can prescribe Pituitrin. If you look in the introduction of Pituitrin, it has been mentioned as a vasoconstrictor, right? So it constricts the blood vessels. Now if you think of any condition where there is vasoconstriction or there is constriction of the circular muscle fibers, there is a wonderful action of your Pituitrin. So you think of angina, where there is constriction of the muscles, right? Constriction of the muscles of the heart. You think of a patient with menstrual colic, menstrual pain, where there is constriction of the muscles, severe spasm of the muscles. If you think of a case of hernia, where the viscus is strangulated in the canal and there is constriction of the muscle surrounding it, and you find the wonderful action of Pituitrin to unfold. You're with me? I shared with you heart, angina, constriction of the circular muscles of the heart. I shared with you dysmenorrhea, where there is severe spasm, constriction of the uterine muscles, constriction of the muscles of the fallopian tube. I shared with you cases of strangulated hernia, where again there is constriction of the muscles surrounding the viscus, surrounding the viscera, right? And these are three brilliant areas where you'll find the action of Pituitrin to be very, very useful. So, as a proving symptom, it produces vasoconstriction. It produces constriction of the muscles. But when you give Pituitrin, when you administer Pituitrin, it causes the relaxation of the muscles. Let likes be treated by likes. You're with me? So, it's a very underrated medicine. We don't use this very often, but it's a wonderful sarcode. You understand sarcode prepared from healthy products. It's prepared from the healthy pituitary gland, right? So it's a sarcode. Pituitary gland. So it's a sarcode, Pituitrin. Now if you come straight to the theme and essence, please. You see spasm of the circular muscle fibers. What are the areas of spasm? Gallbladder colic. So severe pain with gallstone, with gallbladder there is severe spasm, severe pains. You can administer Pituitrin. Wonderful, wonderful acute action. It's an antispasmodic. It relieves pain immediately. You don't need conventional analgesics and painkillers to help the patient. You can help with Pituitrin. Number 2, wonderful for angina pectoris. So spasm of the cardiac muscles. You got that? Cardialgia, angina pectoris. So severe pain in the heart. But again, there is constriction of the muscles. So another medicine, constriction of the circular muscles of the heart. Cactus, yes? Cactus has it. But in cactus, you'll always feel a caged sensation. Like somebody is caging the heart. Right? A caged sensation. Clasped and unclasped. Remember that for cactus? You hold it, you're holding the heart with the iron hand. Clasp, unclasp, clasped, unclasped. That's important for cactus. Right? There's a good book by an Indian author. It's called S.K. Ghosh, Metromedica of Rare Nosodes. Right? If you can get that online, S.K. Ghosh, Metromedica of Rare Nosodes. And there he mentions Pituitrin is very, very useful, especially when you have symptoms midway between cactus. So you have the constriction of cactus on one hand, and you have the stitching pains of nausea on the other hand. You remember we have done nausea as well. Nausea, you have a stitching pain in the heart. So you don't have that degree of stitching pains like nausea, or you don't have the typical clasped and unclasped sensation of cactus. So your Pituitrin is midway between those two medicines. So whenever there is angina with some stitching pains, with some constriction, you always think of your Pituitrin. That's why it's a wonderful, wonderful medicine for chest pains, cardiac pains, angina. You're with me? With the stitching pains of nausea and with the constriction of cactus. So that's why angina is a wonderful area for your Pituitrin. Third area for which is prescribed really well is uterine colic. Wonderful for dysmenorrhea. You know, acute menstrual cramps, if you are not clear with modalities, if you are not clear with sensation, try Pituitrin. Try Pituitrin 30C and it will work very, very quickly. You're with me? For dysmenorrhea, your well-selected medicine fails or patient has to take every time conventional painkillers. For severe cramps, Pituitrin will help. Why it will help? If you think it's prepared from the pituitary gland. So, if you think of young girls with dysmenorrhea, you have done the ultrasound, there is no problem with the uterus, there is no problem with the ovaries, but the hormonal pathway is disturbed. And because the hormonal pathway is disturbed, they are getting severe menstrual cramps. You are with me? So, when you administer Pituitrin, it acts on the pituitary and the hypothalamus axis, and therefore it clears or it corrects the hormonal imbalance, and therefore the menstruation is all right, the menstrual cramps begin to disappear. So, it will not only act as an immediate painkiller, you are with me? It will not only act as an immediate pain reliever, but it will also help in setting up the pituitary axis in the right plane. So, whenever the pituitary axis is in the right plane, the hormonal imbalance starts to improve and they feel better. So, you see it acts on the two pathways with Pituitrin. You are with me? So, uterine colic is again very, very important. Fourth, very importantly, if you see strangulated hernia, it's a wonderful, wonderful medicine for acute pain of hernia, especially strangulated hernia. You know, like they will tell you, I exert myself or I walk, I have severe crampy pain with my hernia. There also your Pituitrin can help. And obviously, when there is strangulated hernia, you can understand there is very severe pain, and immediately sometimes Pituitrin can come to the rescue. So, not just strangulated hernia, but even acute pain of hernia, your Pituitrin can take care of those symptoms. You are with me? So, 4 pain relieving areas I shared with you. Number 1 is this cardiac, when it's midway between naja and cactus. Do not have the constriction, the clasp sensation of the cactus, nor you have the stitching pains of naja. It's midway. I shared with you this then, gallbladder colic, right? Severe pains due to gallbladder stones. I shared with you menstrual colics, menstrual cramps, where it works in 2 ways. It helps in relieving the pain, also it sets the hormonal imbalance in coordination. So, therefore, the patient starts to improve. And 4th, hernial, especially inguinal hernias, right? Inguinal hernias, pain of hernia or even strangulated hernia, your Pituitrin can take care of. All work well in 30C, even you can get 3x, 6x triturations if the patient is on any constitutional medicine. But dysmenorrhea, believe me, dysmenorrhea and angina work best with 30C. So, whenever you are prescribing, like they have come to you for dysmenorrhea and they tell you, oh, I have taken painkillers all my life. You have done the ultrasound, there is no pathology, especially with young girls, Pituitrin can really help. Angina and dysmenorrhea, 30C works best. Angina and dysmenorrhea. Alright. So, spasm of the circular muscle fibers. You see, I mentioned a spasm reliever. So, it relieves the spasm. That's a very important area for your Pituitrin. So, that's one of the acute areas where you can prescribe. 4 important colics I shared with you. Do please remember them. And those are 4 areas where Pituitrin can help. Next, you see I mentioned here delayed puberty. It's, if you think again of the physiology, it has an action on the pituitary gland. And pituitary gland is responsible for the endocrine function of all other glands, right? It's the master of the endocrine system. So, whenever the pituitary system is affected, pituitary gland is affected, it takes a toll on all other systems, right? Therefore, the breast development is poor. The testes is undescended, testes is underdeveloped, right? Breast development poor for the female, testes undeveloped for the male. Poor or delayed development of secondary sexual characteristics. 17-year-old, 18-year-old girl still having amenorrhea. 18-year-old girl, very flat breasts, poor development of the breasts. 17-year-old boy, very underdeveloped breasts. You got this? Delayed puberty. right? So, you know, the secondary sexual characteristics are not developing. Close to aurum met, as I shared with you earlier. You remember aurum, where the testes are undescended or undeveloped. Similarly, in pituitrin, pituitrin is more applicable for female secondary sexual characters not developing. You are with me? Breast development, very poor. Amenorrhea in a 17-year-old girl, in an 18-year-old girl. You have tried your constitutional medicine, it's failing. Do please try Pituitrin. You are with me? That's why again, you know, wherever you have notes for pulsatilla, you remember pulsatilla delayed first menstruation. So there, if pulsatilla fails, you can try Pituitrin for amenorrhea in an 18-year-old, 17-year-old girl. You have done all the tests, there is no abnormality, but still menstruation hasn't started. It's a hormonal incoordination, and Pituitrin will take care of that. So delayed first onset of menstruation when pulsatilla can fail. You see, tone subcorpus luteum, estrogenic hormones, defective development of breast, delayed development of secondary sexual characteristics. So breast and menstruation, they are undeveloped or underdeveloped, and your Pituitrin can take care of that, right? And delayed development of secondary sexual characteristics in a female, in a male as well, as I shared with you, undeveloped testes, Pituitrin can take care of that as well, if your well selected medicine has failed. So one is the acute area. What is the acute? Pain reliever, spasm reliever, right? And the chronic area is you are prescribing to correct the endocrine imbalance. Because it is the master of the endocrine system, it will take care of the hormonal incoordination and set it in the right pathway, so that the breast development starts, so that the menstruation starts. Believe me, I have a lot of 16, 17-year-old girls who haven't had their first menstruation, and Pituitrin helps. Or say the patient has been on the constitutional medicine, it has taken care of a lot of things, but the breast development is still poor, and the parents are really concerned because of the poor breast development. And when you give a Pituitrin, say 200C or 1M, it immediately helps to stimulate the breast development again. You're with me? So that's an important area of your Pituitrin. So pulsatilla followed by Pituitrin is a good chain, or you can use Pituitrin as an intercurrent for delayed development of breasts. Undescended testes, 3 medicines, which you can obviously try before they are going to go under the knife. Aurum metallicum, right? Aurum metallicum is undescended testes with feminine appearance, right? You remember that line in Allen's, lacking in boyish go. So, you know, like behaving like a female with undescended testes and with with atrophic testes, right? Right? Aurum met, undescended testes with feminine features. Remember that line, lacking in boyish go. Second one is Pituitrin, right? Undescended testes with other secondary sexual characters haven't developed as well. Like for a male, say a 16-year-old, 17-year-old, no growth of body hair, no deepening of the voice, what you expect with a 17-year-old. So poor secondary sexual characters, along with that undescended testes. Right? And the third medicine which you can use with good results for undescended testes as well is thyroidinum. We have done thyroidinum earlier as well. Especially for thyroidinum undescended testes, there is a strong family history in the mom of lot of disturbances during pregnancy. So, lot of diseases, lot of symptoms came up during pregnancy. You're with me? could be excessive vomiting during pregnancy, could be hypertension during pregnancy, could be diabetes mellitus during pregnancy, and the child now has been born with undescended testes. Right? You remember maladjustment for thyroidinum? So maladjustment in the mom during pregnancy, undescended testes in the child after birth. You with me? So these are three which you can use for undescended testes. An underdeveloped breast, another medicine. Pituitrin is obviously there. Have a quick look in Boricae, please. Sabal cerulata. Sabal, S-A-B-A-L, Sabal. In Sabal cerulata, it mentions, have a quick look, please. Underdeveloped mammary glands, underdeveloped breasts. Sabal cerulata is essentially a prostate medicine with the mentals of phosphoric acid, boric. Boric, S-A-B-A-L, Sabal. You got that? Could you read that line, please? Breast. Introduction.
Genital urinary. Okay. Sabal.
Does it mention about underdeveloped breasts?
General and sexual debility.
Valuable for
Mammary gland.
undeveloped mammary glands.
Yes, valuable for undeveloped mammary glands. Right? You got that? It has the mentals of phosphoric acid, very indifferent. You know, there is a line also in Sabal, if you look under female or male, it mentions sexual neurotics. It means they're sexually very weak.
Yeah.
Sexual neurotics. Under male or female?
Young female neurotic.
Sorry?
Young female neurotic.
Yes.
Sexual or in male? Sexual neurotic.
Also in females, young female neurotics. So their sexual desire is high, but now due to excessive onanism or abuse, they have weakened libidos. Right? And poor development of mammary glands. So Sabal cerulata is a lesser known medicine, but Pituitrin again is very important because of this. It has an action on the pituitary gland, therefore corrects the endocrinal imbalance. Right? Potency for Pituitrin, 30C for dysmenorrhea and heart, angina, and 3x, 6x for hernia and gallbladder colic as well, 3x, 6x. Gallbladder colic 3x, 6x, hernia as well as 3x, 6x. And for delayed development of breast and amenorrhea, what potency? Amenorrhea. And delayed development of breast, yes, 200C, 1M. (200C and 1M). That's about your Pituitrin.